This episode of Ask Me Anything, I got a great question from a massage therapist on LinkedIn. They asked me, how do you manage and treat IT band syndrome? What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to easily double their income, all while working 50% less. So IT band syndrome, let's just be honest here. Anytime you see a diagnosis with syndrome in it, it normally means that nobody has an idea of what's going on. I call it a junk box bullshit diagnosis. And there's lots of problems in the body that are diagnosed with syndrome: IT band syndrome, carpal tunnel syndrome, lateral patellar tracking syndrome. Anytime you hear syndrome, just get your bullshit meter out and say, whoever diagnosed that person really doesn't have a clue. I always teach and I train in my system, the Peak Method, we must get to a tissue-specific problem list, and there's only 7 problems for that. I will link that webinar up here on the YouTube video. But you have to have a tissue-specific problem, because how in the hell can you fix a problem if you don't know what it is in the first place? So first question I always ask, well, not the first question, but one of the questions that I'm really trying to decide, do I have a local problem in the area, specifically in this question to the IT band, or is it a compensation problem? The question is simple. Was there trauma or not? So if someone got kicked in the IT band, maybe they got hit by a car, they fell in a hole, they fell downstairs, and the lateral part of their hip hurts where the IT band is, I'm like, okay, and you probably do have an IT band problem, but most people don't have a direct trauma correlated with their injury, and it ends up being a compensation and a biomechanical issue that's coming from somewhere else. So ask that key question: was there trauma or was there no trauma? It's going to really help you understand what and where and how to treat. We spend so much time in the musculoskeletal world, really in just healthcare in general, of treating the effect of a problem as opposed to the cause of the problem. So we're like, well, it hurts here, this must be the problem. But that's not the case. We have to really dive in deep and think critically and be able to figure out exactly what's going on. So I see a lot of IT band syndrome clients and patients that come in and present with this type of pain. And I get it. We want to be simplistic in our thinking. We want to be reductionist and be like, well, you got this problem, this is what we're going to do. Because when we have a simple problem, we want to have a simple protocol to go after it. But that's not getting to the root cause. You're treating the effect. Once again, you're not getting to the cause, and you can't fix that problem if you don't know what it is in the first place. So I always give like a group project analogy. So usually what I see in an IT band syndrome without any trauma is something else in the chain isn't working correctly. And usually it's going to be something deep in the hip, more specifically the adductor magnus. So the adductor magnus is such a big and powerful and strong muscle. It basically drives our hip through space and helps to flex the hip. And it gets really beat up and really worn down in people that do a lot of running, jumping, squatting, all types of exercise out there. And it develops a lot of scar tissue. And when it develops scar tissue, yes, you can get scar tissue without an actual injury. You don't get enough blood flow, you don't get enough oxygen, and it makes that muscle weaker and less flexible. So the force has to go somewhere. So say someone's running 5 miles, but their adductor magnus is loaded up with a significant amount of scar tissue. Now maybe the adductor magnus can only produce 1 mile of that 5 miles. So that force has to go somewhere. That client is still running. So what happens is the IT band kicks on, and instead of doing its 5 miles, it ends up doing 9 miles. So usually the thing doing the extra work is going to be the thing to complain the most. So that's where that trauma or no trauma really kicks in and getting to the root cause of what's going on. So I tend to find so many lateral hip, bursitis, even anterior pinching of the hip, or IT band syndrome, if you want to say that, is due to an adductor magnus problem. So what I want to include in this week's AMA, I'm going to include a video of me palpating and treating the adductor magnus effectively using my system, manual scar tissue treatment. So I'll link that up right now. We're going to be treating the adductor magnus. Make sure you watch the advanced palpation before, because a lot of times people aren't actually on it. They're either on the gracilis or the hamstring, and when you don't get this right, it can make it very excruciating for your client. Now, the key here is all in the body and the mechanics and everything set up for that. So what I like to do is have it resting right on my hip, because what we're going to be getting is this hip flexion, and you're going to use that to kind of lean away. So after you palpate and you find the area, you want to get in there and get some lotion on it to start, because this area can be very sensitive, but it's very important for overall hip function. Once you identify the area where the scar tissue is, now you're going to get in there and start to do the treatment as well. So you found it, let's say you found the scar tissue right here. We want to go just inferior to it, because this is going to be internal slide, it's going to come to us. So what I do is I see how this is right up against my body in here, and I'm going to get into a stance where I'm facing away. And the first thing you're going to do is you're going to back these thumbs up. So come in a little bit closer for me. So what you're going to do is back these thumbs up. This is going to allow me to get my depth and my tension. So the first step is I'm going to get my depth by leaning in with my body, just like that. I'm going to come out just a little bit, and then my tension is going to be rolling my thumbs just like that. That area is loaded up, and then what I'm going to do is take this other foot and step that back, and I'm going to go nice and slow and let that come to me. I am not going to slide, I'm just going to be very precise and let that come through. And you want to go nice and slow with this treatment as you do that. Get this leg in your hip. It's going to help you take some of that pressure off your hands. And the key here is you're going to reach with this opposite foot in almost like what's called a fencer stance. So when you finish, you're going to end up like this. So I'm going to show you the way the motion looks. So I'm not going to do the actual treatment part here. I want you to see the body mechanics. So we sink, we're in, I step this way, and then I lean away like that. And I can really, when it's a really bad area of scar tissue in the adductor, I can lean my body in there and get some of that increased tension in there. So the key is getting that motion first, but taking the time when you start to find the area where that area where that scar tissue is. And if you're still learning, getting it figured out, draw a little marker in there too. It might help you kind of line it up, because if you did all the work to find it, but then you're thinking about the mechanics, it's going to mess with you just a little bit. But this area is very important, and the key here is using your body and using your weight to allow you to get the rest of that motion in there. So as you can see in the video, it's very precise, it's very focused. We're not just jumping in there and jamming on some areas. It's a very sensitive area, but if you can get proper depth and proper tension onto that muscle, you can break down that scar tissue, take the pressure off of the IT band, and get that client functioning a hell of a lot better, and hopefully getting them out of pain so they can feel better, move better, and eventually just be back to normal from where they are. But it starts with thinking critically. So a couple take homes from this video. Number one is just ask questions. Think critically. Don't jump right into treatment. You know, as manual practitioners, we want to get our hands on someone right away, and we go really fast. But I always say, in order to go fast, you got to go slow. Collect some data, ask the right type of questions. I'll link those up right now. I have a webinar where I talk about the 12 must-ask questions before you ever lay your hands on the client. Once again, slow down. Quit being in such a hurry. Quit trying to apply so many treatments. Apply the right treatment, the correct treatment that becomes the most safest and the most effective and the most durable. And lastly, be a clinician first. Use your brain. Think. Figure out problems. Then become a technician. Because as I always say, you can't fix a problem if you don't know what it is in the first place. So that's all I got for you guys. Thank you so much for sending over that question. If you liked the video, give it a comment, like, or share. If you have any specific questions you want me to cover, send me a message. Always here to help. Go grab my free training. My free training is better than any other paid course out there. You're going to learn so much in critical thinking, figuring out problems, advanced palpation, even treatment demonstrations, and put you in a much better place than everyone else out there around you. And lastly, if you really like what I do and you like what I'm sharing, come take one of my courses. They're approved for CEUs, and you'll be on that path to working smarter, not harder, doubling your income while working 50% less. Appreciate you guys, and I'll see you on the next one. Bye.